what do we mean by when we talk of family medicine? When we use this term of family medicine? So, family medicine is a medical specialty. It is a recognized medical specialty. Many times people ask, is it recognized by Medical Council of India? Is this discipline recognized by Medical Council of India? Yes, it is. If you look at the postgraduate regulation of 2000 of Medical Council of India, it is mentioned as a distinct specialty. Then, of course, why it is an academic discipline? Because it has an academic body of knowledge. And then it is a philosophy of care, because traditionally what we are normally introduced to is, a unilateral pathway of, from basic doctor to specialist doctor to a super specialist doctor. But the philosophy of care of family medicine is different. It is, reverse of that. It is anti-engineering of the concept of specialization. It is about caring of the whole body. It is about the wholesome care, because human body is not in bits and pieces. It comes in a one unit. Then it is a vocation. Vocation means it is a career pathway. We all know, in the beginning, all doctors used to be family physicians. Before this is, this momentum of specialization came into our country and many parts of the world. All doctors, every doctor used to become first family physicians. But those days there were ample opportunities for practical learnings. People used to do 2 years, 3 years experience in different departments, and it was not well structured. Still, if you look at the previous generation's family physicians, skills and experience and their competency, it is way ahead, because they provide and cater to a large number of clinical problems within community setting. And then it is also a service delivery interface. In hospital, the clinical presentations in a tertiary care hospital, if you look at medical college hospitals, the presentation of a disease is different, but when it is in community, in the beginning, the symptoms and symptomatology is often undifferentiated. So when the problem comes to a family physician, it is, for example, I give you headache. Now, headache can be from any source, any reason, any etiology. For example, headache could be originating from a dental problem, or eye problem, or it may be a neurological problem. So all these problems are undifferentiated when they come to a family physician. So the interface is different, and when it reaches medical college hospitals, often the diagnosis is already made, and now the intervention and final treatment is done. I'll take you why a lot of people ask why family medicine is still relevant, because this is a very important question. Because nowadays this is a age of specialization. Even we say that the common people, public, want to know about your specialization, and they will ask which organ you specialize in, kind of questions. And a lot of services are still focused and available in the big hospitals, large hospitals. Government is also strengthening the hospital systems. So why family medicine is still important? So there is a paper published in New England Journal of Medicine. It's a very classical paper related to family medicine. It's called Ecology of Medical Care, and it's a very important concept. And I request you, all of you, to listen with attention. This paper says, it was published in NEJM in 1961. It says that in any given population of 1,000, in every month around 750 would experience some kind of illness. It can be a small injury, fever, headache, minor ailments. And out of the 750 people, only 250 will consult any doctor. And most of the time these are the doctors who are available closer within the community itself. And out of the 750 morbidity, only 9 people require some kind of admission to a hospital, and only 5 of these require referral to a tertiary care, and only one requires referral to a medical college center. So you can see the morbidity level is of 750, and only one person that we see often at medical college hospitals during our MBBS course is one only. So what we see is the tip of the iceberg, and the profile and presentation of the patients is entirely different one they are seen in the community and the initial levels. And this 750 morbidity, or you can say 250 morbidity, is often not catered to appropriately. And this is a huge in terms of finances or economics also. This is a huge opportunity for any medical service provider, that if you cater to and target these 250 people who are facing morbidity and ailment in the community, there is huge career opportunity. And same study was repeated again in 2001. The earlier was in 60s, 70s, and this one, the recent one, and the findings were the same. Again, the profile of the patients, their mobility, their experiences with the illnesses was same, and very limited number of people actually require tertiary care facilities, while the remaining one, especially in country like India, where we have nowadays a culture of specialization and going to a specialist, still the large number of this morbidity, in if you talk practically, goes to quacks, buys medicines from pharmacies, and and in spite of this opportunity, large number of medical graduates are not aware of this career option of family medicine, which is very, very viable. I can give you tens of examples. I was myself working in a government institution in Delhi government. I was getting good handsome salary, but I decided by choice to leave a government job and work as a practicing family physician in a community, because this is, I mean, not only from the perspective of my own personal satisfaction, the kind of medicine I want to practice, but also financially it is viable and better than doing any job for me. I'm a recent example, and there are tens and hundreds of other people in our academy who have done similar experience. Uh, this all we know, and this is how human health is seen and taught at traditional medical curriculum. And if you look in MBBS, there are 20 departments where there are 20 subjects which are recommended, and you have to get qualification on them. We all are very good students. We are bright students, bright people, but you know, just mugging up the books, cramming the facts would not make you a competent doctor. So while many times we may think, okay, we have read everything, but how to write a practical prescription of hypertension, how to initiate treatment of diabetes, how do you address to a person who comes to you for the first time with severe headache, so how do you manage common trauma and injuries in your own practice, the smaller ones. And there are several practical things, for example, immunization. We all read line by line in our test books from pediatrics, from community medicine, but when it comes to practically giving or administrating immunization to children, to older people, to younger adults, many of us not seen the actual ampules or the how it is presented, in what form it is available. Many times we are even confused for giving how do you give prophylactic vaccination for rabies, even smaller questions about tetanus. These are common things, but when it comes to practice, we are not very well prepared, and the purpose of such course is to prepare ourselves for providing a wholesome whole person care. Now, we all know about this one pathway of a specialist pathway. You are a basic doctor when you are MBBS, you become a specialist when you do your post graduation, and then you become a super specialist. And this is, traditionally what we are, introduced to. What we are not introduced is the concept of generalism. Now, this term may sound very unfamiliar, and some type kind of contradiction of what we are normally accustomed to hear. What is and why it is important, why generalism is important. So uh, in uh, so in if you look at the this graph, specialists have their specific roles. This is a vertical, uh, this is a vertical There was some technical problem. So why specialization is important and why are generalists important? For any system, there are two types of people required. Specialists, of course, we know are required, and generalists. If you look at the vertical lines, these are the areas and domain of the specialist. If you look at the horizontal plane, which is the interface of the generalist, and what we often lack in our Indian health system is lack of journalists. And journalists have a different approach to the whole problem solving interface in the community setting, and they have the different roles and importance.